Hello, friends and family. Welcome to the very first episode of Health and Meds Made Easy, your calm space for smart health choices. I am Mariana, your pharmacist guide. Today, we are starting with something we all need to know: how to read and understand prescription labels without confusion. You might be surprised how many people take medications every day without fully understanding the label. It's not their fault. Some labels use technical words or abbreviations that makes it hard to know what to do. But misunderstanding your prescription can lead to missed doses, wrong timing, or even harmful interactions. Let's fix that. Here is a typical pharmacy label you might see on your medicine box or bottle. Don't worry, we'll go through each part step by step. First is the patient's name. Make sure your name is correct. This ensures the medicine is actually meant for you. Next is the drug name and strength. For example, amoxicillin 500 milligram. This tells you what the drug is and how much of the active ingredient is in each capsule or tablet. Then you will see the instructions like take one capsule by mouth 3 times a day with food. Always follow this exactly as written. You will also notice the medicine name. This could be a brand name like Amoxil or a generic name like amoxicillin. The generic is the active ingredient in the drug, whilst the brand is the company's version of it, or the name the company gave to their version of that drug containing the active ingredient. An example is these three medications: Moxacil, Moxilin, and Amoxil. They are from different companies, and that's the name the manufacturer gave to each. We can see they come in different packaging designs and probably different prices, but they all contain the same active ingredient, which is amoxicillin, that's the generic, and they even come in the same strength as well. They work the same. Look for the warning section. These are usually in bold or colored print. They might say something like may cause drowsiness or avoid alcohol. These are very important for your safety. Always adhere to them. You will also see how much was dispensed. Example 21 capsules, the number of refills, and the date it was filled, and the name of the doctor and the pharmacy. Now, in Ghana and some other countries, doctors often give handwritten prescriptions like this one. The patient takes it to the pharmacy, there the pharmacist reads it, prepares the medication, and explains everything in simple terms. The pharmacist also writes a clear sticky label containing the direction of use, the warnings, and places it on the medicine package so it's easy to follow. In case you do not see any label on your medications, you can request for it to be written on. That's the appropriate thing to do. Also, before you leave the hospital or after the doctor hands over your prescription, don't hesitate to ask your doctor if the medicine needs to be refilled after you finish it. That is, if you are not told. Some medications are only meant for a short time, but others must be continued. Don't assume, always confirm. Now, here are a few quick tips. Always keep your medicine in the original container. Take a photo of the label before you travel, especially if you're not taking everything along. Don't mix up your medication in unlabeled containers with other medicines. If anything is unclear, call or visit your pharmacist. Lastly, complete your medication dosage. Most importantly, finish your antibiotics unless told otherwise. Now, avoid these common mistakes: taking the wrong dose or at the wrong time, ignoring warning labels, forgetting about refills, confusing generic and brand names, not checking the expiry date. Thank you so much for watching this very first episode of Health and Meds Made Easy. Again, I am Mariana, your pharmacist guide. If you found this helpful, please subscribe to this channel. Also share to others so they benefit from this. And also like and leave us a comment about your thoughts and questions. We'll be happy to have them. Stay tuned for our next topic. What's the difference between over the counter and prescription meds? We'll see you in the next one, if God permits. Bye bye for now.